for many patients, they're not convinced that they actually have epilepsy and require treatment. And especially after the first seizure, I mean, there's always a reason why people think that they might have had that first seizure, whether it's uh, being sleep deprived, or if they've had excessive alcohol intake, or if they've been traveling somewhere. So, I mean, I think in hindsight, a lot of them just try to blame it on some other event that could have occurred that could have caused that first seizure. So it's very, very common, really, for patients to resist treatment. And especially if they haven't had any injuries related to those seizures, many times patients are unconvinced that they're going to have another one again, and they have heard bad things about medications, and there's just a lot of resistance for them starting medication at that point. And I think there's a growing awareness of epilepsy, and patients are certainly more likely to present to a physician if they've had a seizure or they have ongoing seizures. So, I mean, I think it's a difficult question to answer whether the overall incidence and prevalence is changing. But certainly there's so much more awareness that I think people are much more willing to present to physicians if they've had a seizure. Also, I think there used to be a social stigma associated with the diagnosis of epilepsy. I mean, even though there's still that stigma, I think a lot of patients are more willing, certainly, to admit that they've had a seizure and then present to a physician for treatment. We used to have a whole category of seizures and epilepsy that we used to lump under the term idiopathic, where we didn't really know why they had a seizure. But there's certainly a growing awareness that things like autoimmune etiologies may play an increasing role in some of these patients that were thought to have so-called idiopathic epilepsy. I think with advanced imaging techniques, we're able to identify lesions in the brain that we were not able to identify before. So, I mean, even in older patients that present with a new diagnosis of epilepsy, oftentimes we find a very small cortical dysplasia that could have caused that person's seizure. And I mean, this would never have been picked up in years before, especially given the fact that our understanding of the causes of epilepsy and our imaging modalities were just not as robust as they are now. Main tests that we perform in patients that have a diagnosis, that we're trying to diagnose epilepsy, would be an EEG and an MRI scan of the brain. And despite the advances, especially in imaging on the MRI side, we've gone from 1.5 Tesla MRI machines to 3 Tesla MRI machines, and now 7 Tesla MRI machines. Oftentimes, the testing still comes back normal. And I think the number that's kind of agreed upon is around the 50% mark, where certainly MRIs can be normal. EEGs are just a snapshot in time for a particular patient. So again, around 50% of EEGs can be normal after the first one is performed. And that's a big problem for a lot of patients, because oftentimes they've had a sort of a life-altering event, and the testing comes back normal a big percentage of the time.